How can a practice continue to do the right thing and yet stay fiscally sound?
I once became a pediatrician when I was 5 years old.
As
But
a pediatrician,
I did house calls in the early days. I mean, I started practicing back in the 70s. So yes, I would do house calls. Everything changed. The insurance company became the middleman and they were taking money out of our pockets. We did have someone in our community who, older than I was, making house calls for many years. And he was famously known for jumping out of the window when the husbands would come home. If you're taking good notes, which is what you must do, you really have to document what you've done. It's a lifesaver, and it ties into coding. So I was a resident, and I would wear my white lab coat, and they would see me and say, "Okay, Doc, come on, come to the front of the line." My mother wouldn't take my brother and I to the pool during the summer because polio was rampant, and we had the iron lungs. And people were deathly afraid of it until polio vaccine came out. Back in those days, it was very little mental health. I don't think I even knew what autism was back in the 70s. Certainly, you weren't looking for treating depression and anxiety. I couldn't do that. I wasn't putting it in a 7-hour day. I was putting in 10-hour days to see that many patients. But you had it as a kid, thank goodness, because if not, you might not have made it to the ED. The fact that today you get a discount if you pay for your vaccines within the first 30 days, that came from our group. We really made an impact.
Back then, I think the vaccines were what, $3, $4 a dose.
Yeah.
Now they're $300, $400 a dose.
Today, that house, you can't get into a house in that neighborhood for less than $1 million. You can't compare $2 back in 1970 to $400 today. Inflation takes a toll, and the cost of doing these things takes a toll.
I had my old child study team where we evaluated kids for school systems as well as privately. Things have certainly changed. Coding helps us because it tells the insurance company, I've done X, Y, and Z. I contracted with you to be paid this number of dollars for this code. I want to be paid. Some of them don't accept CPT coding, although we physicians must use them. We've got to go by CPT rules, but the insurance companies don't. In the old days, if you complained to an insurance company, they would say, Randy, you're the only one.
Yeah.
But now, if you can show them 100, 200, 500 people around the country, they can't say that anymore. Codes change every year, the CPT codes as well as the ICD-10 codes. But come on, there are people, George, who still don't understand the basics. If a kid came in for a flu vaccine, besides billing for the vaccine and the vaccine administration code, they're putting it in office visit when they didn't do anything. And they want to know, why am I in trouble? People will be shocked how many codes there are into care coordination and chronic care management. You have to know about them. You have to know the differences between each code. But there's so many, and so many where it doesn't have to be the doctor who's doing the work.
For that time, that hour I spent presenting the case, going over the case with a psychiatrist on the phone, trying to coordinate care for this patient, Virginia Medicaid says that work is worth zero. Virginia Medicaid does not consider obesity a chronic disease. She got a letter from Anthem Blue Cross Blue Shield that has over 40% of the business in the country saying, you're seeing too many 25 modifiers with your well visits. Stop it.
So for me, who had very little Medicaid where I practiced before, overwhelmingly 90% of all the patients I'm seeing now are Medicaid. And my attitude is the same as yours. So someone comes in for a well visit and they're obese, I need to address them.
Right.
Medicaid is a pain. Absolutely a pain in the neck all over the country. I love what I do and I love helping the kids. All right, make a little bit less money. You want to work smarter, not hard. We can't stop fighting because if we do, they'll just take things back. Easily 64% of my sick visits were fours. Not because my patients were so complex, but I took my detailed histories and I documented it. I took my physical and I documented it. I was audited multiple times going back into the 90s by all the insurance companies, but I never paid a penny back to them because my documentation supported my use. Medicaid Connecticut was going crazy going after pediatricians. Large practice, they ordered them, they wanted $600,000 back.
Wow.
I reviewed the charts, and Medicaid was right, 80%. If you don't document what you did in the chart, you're lost.
I'm getting paid to make sure your kid is taking as little medicine as possible, because that's always the best, but enough so that they have a good quality of life and they don't end up with a bad outcome.
The right thing is taking care of the patient, period.
Right.
And then it's fighting with the insurance companies. I got a call last night at midnight from a parent, horrible Kruger. I haven't seen Kruger for a while. The kid was really nasty. Am I getting paid for being woken up at midnight? No, but that's what I signed up to do, to take care of my patients. Telemedicine, you're seeing the face, but you're not seeing them fidgeting with their fingers or whatever else they might be doing.
Just put it in the doctor's schedule, just like an office visit. There's nobody can complain about it then.
Where it doesn't work, the time doesn't work, the time billing doesn't work in Virginia, in particular with Medicaid, and some of the commercial payers are worse than Medicaid in the amount that they pay pediatricians. If I can see 3 strep throats and the 99214 in Virginia pays, I think, $90, and those are, they take 10 minutes. So I made $300 worth of revenue, which is enough to pay the staff and pay myself something. If I spend 45 minutes with a depressed patient that takes 45 minutes and I'm doing it on time, that's $100. It's so difficult to be able to do what I think we should be doing as pediatricians, which is having the space for the acute care kid that got the bellyache or the sore throat or started wheezing, doing the chronic disease management and still doing the well child exams, and being able to run on time and be paid enough.
That's why I know that the Academy is trying to work on parity for mental health issues. They understood that by allowing one person in the practice to deal with these issues, it freed up the rest of them to do 5 or 6 visits in an hour. So they were more than happy to share some of that revenue with the person who is doing all of the behavioral and mental health issues.
The truth of the matter is, people pay a lot of money for their insurance, should pay for services. Simple as that.
Aiden brought in, we found out his nickname was the killer, because they would bring him in from wherever he had to go in the country to beat the heck out of doctors.
Women have a tremendous amount of power because they win elections. And when women start complaining to their elected officials, the elected officials don't like it.
The government is demanding more and more of me, and time I've got to spend because of the insurance companies. Outside of just seeing you, when I rose in the ranks of the national, boy, within hours, I could call up the CMO of any major insurance company, let them know my title, and they called me back right away. You've got to be able to not be afraid of the insurers. You've got to go toe to toe with them.
Right.
It's a multi-pronged approach to get what we need.
If you want the younger doctors to be involved that are not making that much money in pediatrics, and they still need to pay bills, we need to pay for this time.
It's only 10% that you would need in any given geographical area. So to say no to them, to make them sit up and listen and change the way they do things. We need to be paid for this. It's our time. And this person, very altruistic, said, no, it's a responsibility we have. Yeah, it is, but there's only so much time in a day.
In certain age brackets, the number one cause of death is death by suicide. It can be prevented if you're a pediatrician. How much is your child's life worth? How much is your neighbor's child's life worth? But we can't spend $10 to prevent a child from dying by suicide. How is that?
But why would Medicare decrease what they're paying physicians in general per RVU when prices are going up? The cost of labor, your vaccines, the table paper. It just makes no sense at all.
They spend $1.5 million a year lobbying, which is nothing in DC. You need 60% consensus to move on things like this. So you have to have friends on both sides of the aisle. You cannot just be on one side if you're going to be effective.
Get rid of 10 vice presidents and you get more than enough money to make up for the difference.
We're in Virginia, less than 50% of the kids have a medical home. And we're spending less than 5.5% of every healthcare dollar in primary care. The truth is, already nationally, 15% of children don't have access to primary care. Nobody wants to pay us what we're worth. Then you pay me out of pocket $3,000 and I'll bill your insurance. And then I can make it work and I can do a good job for you. Dr. Bravo, you're adorable. Would you just please shut up? You're a walking encyclopedia. I can't take any more facts.
You need to follow your heart. You have to be happy in what you're doing. Are there issues that come up? Yes. Yeah.
A big part of the joy is the relationships that you build over time with other colleagues. And Epic and the EHR and texting has, in some ways, really destroyed that.
Insurance companies know the value of pediatricians because when families want to look at insurance, who do they look for? And we forget how much power we have, but we don't use it.
Absolutely right.
Yeah. A
Absolutely.
little bit more than just runny noses
Yes.
and shot givers.